Hi everyone, welcome back to my YouTube channel and today we are going to talk about sarcoidosis. So let's start our topic with introduction. Sarcoidosis is a multi-system granulomatous disease of unknown etiology that is characterized by formation of non-casseting granuloma in affected tissue. It primarily affects the lungs and lymph nodes but can also involve the skin, eyes, salivary glands and oral cavity. Although oral involvement is rare, it is clinically significant because it can mimic other oral pathologies including neoplasm and infections. Definitions of sarcoidosis. Sarcoidosis is defined as a chronic systemic disease that is marked by presence of non-casseting granulomas in one or more organs, that is most commonly in the lungs and lymphatic tissue. Etiology of sarcoidosis. The exact cause of sarcoidosis is unknown, but several factors contribute to it. Factors include genetic predisposition, as certain HLA genotypes increase susceptibility of sarcoidosis. Familial clustering is observed in this case of sarcoidosis. Second, there are environmental factors that may contribute, as exposure to organic and inorganic antigens and infectious triggers like Mycobacterium species or Propionibacterium acnes have been suggested for the cause of or risk factor for sarcoidosis. Third etiological factor is immunological dysregulation, as abnormal cell-mediated immune response and excessive activation of T helper 1's lymphocytes and macrophages can contribute to sarcoidosis. Pathogenesis of sarcoidosis. Sarcoidosis develops through complex immune-mediated process. First, there is granuloma formation that is triggered by an unknown antigen. There is activated CD4 T lymphocyte that release cytokines that include interleukin 2 and interferon gamma. Macrophages then differentiate into epithelial cells, forming non-casseting granulomas. Then giant cells and fibrosis may develop over time. Then there is multi-system involvement, as granuloma can infiltrate various organs. Salivary glands, especially parotid, may become enlarged because of this. And oral mucosa involvement may cause nodules, ulcers, or plaques. Clinical features of sarcoidosis. First, there are systemic symptoms that include fatigue, fever, malaise, and weight loss. Second, there is lymphadenopathy, especially cervical and hilar nodes. Third, there is pulmonary involvement that may include dry cough and dyspnea. Then there are also oral and salivary gland involvement, as parotid gland enlargement is in there, that may be unilateral enlargement or bilateral enlargement. There is dry mouth or xerostomia if salivary function is compromised, and there is oral mucosal lesion that are firm and painless nodules, and there are ulcers and granulomatous plaque on gingiva, palate, and lips, and this may make neoplasm or chronic infections. Then other organ involvement features include skin that may appear as erythema nodosum and lupus perineo. In eyes, it appears as uveitis or conjunctival granuloma. In liver, heart and nervous system involvement is also seen in severe cases of sarcoidosis. Histopathology of sarcoidosis. There is non-casseting epithelioid cell granulomas. Multinucleated Langerhans type giant cells are there. Their lymphocytic cuffing, mostly CD4 T lymph cells are there, and there are no central necrosis that distinguish from tuberculosis. Special stains are negative for bacteria or fungi. Diagnosis of sarcoidosis. First, there is clinical evaluation that includes history of systemic and oral symptoms. The physical examination of lymph nodes, salivary glands, and oral cavity is done. In diagnosis, second we do is imaging that includes chest x-rays or CT scan for hilar or mediastinal lymphadenopathy, MRI if CNS involvement is suspected. We can also do laboratory tests for diagnosis that include elevated serum angiotensin converting enzyme level, hypercalcemia in some patients, and complete blood count and liver function test. We can also do biopsy in diagnosis that confirm presence of non-casseting granulomas. Oral mucosal biopsy may reveal granulomatous inflammation. Differential diagnosis of sarcoidosis. It needs to differentially diagnose from tuberculosis and atypical mycobacterial infection, from fungal granulomas, from chronic cellulitis, from sarcomas or lymphomas in oral cavity. Management of sarcoidosis. First we do is observation, as many patients with mild asymptomatic sarcoidosis may not require treatment. Second, we can also give corticosteroids, that is mainstay for symptomatic or organ-threatening disease. It reduces granulomatous inflammation. Third, we can also do immunosuppressive therapy, that is for patients that are resistant to steroid, and they include methotrexate, azathioprine, and hydroxychloroquine. We can also give symptomatic management. As for xerostomia, we give salivary substitute or cellulox. For oral lesion, topical corticosteroids or minor surgical excision is done if necessary, and regular monitoring of organ function is done in this case. Prognosis of sarcoidosis. Generally favorable prognosis is there for mild and localized disease, but in case of chronic or multisystemic involvement, it may lead to fibrosis and organ dysfunction. Mortality is rare but occurs with pulmonary, cardiac, or CNS complications. Complications of sarcoidosis. It can cause chronic xerostomia and oral infection. It can cause facial swelling due to periodontal enlargement. It can cause pulmonary fibrosis and ocular complications like uveitis and glaucoma. It can cause rare neurological or cardiac involvement. In conclusion of this lecture video, sarcoidosis is multisystem granulomatous disorder that may involve the oral cavity and salivary glands. Oral and parotid manifestation through uncommon may be initially present there. Early recognition, biopsy confirmation, and systemic evaluation are crucial in the management of sarcoidosis. Management of it focuses on reducing inflammation, preserving organ function, and maintaining oral health with corticosteroids at the cornerstones of the therapy. And this was all about sarcoidosis. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.